It's Amy Klingler from the Salmon River Clinic in Stanley, Idaho, back to talk about the stages of Alzheimer's disease and functional loss and care over time. When our patients are given a diagnosis of Alzheimer's disease, it's important to identify the stage. This can help us with timely referrals, resources, and inform our decisions. The Alzheimer's Association provides biological and clinical staging guidelines. The biological staging is based on biomarkers, while the clinical staging is based on functional status and signs and symptoms. The Alzheimer's Association recommends using only core biomarkers. This can be a combination of amyloid and tau PET or T1 fluid analysis and tau PET. There's also a whole spectrum from stages 0 to 6. When we talk about stages 0 to 2, we're talking about biomarker-only disease. Or in stage 2, sometimes we're seeing some mild cognitive impairment. So at stage 2, we have an opportunity to intervene and ideally catch this diagnosis if we haven't already caught it with biomarkers. I anticipate biomarker testing to be more widely available and more widely used in primary care and in specialty care in the coming years. Stage 3 and 4 I think of as mild Alzheimer's disease. This is when a lot of our patients are diagnosed, and it's when we really start to intervene. Patients respond really well to lifestyle therapies at this stage, as well as disease-modifying therapy. You'll hear me say this over and over again, but some of the most important things to me are nutrition, hydration, and sleep at all stages of Alzheimer's disease. It really can make a difference for our patients, because I know it does for me when I'm hydrated, well-rested, and well-fed. In stage 5 is when we're seeing more moderate Alzheimer's disease. Patients are having more difficulty in their executive functioning, more challenges in their instrumental activities of daily living, and they can usually still do most of their standard activities of daily living. Their care partners start to become much more involved in this stage and the next stage because patients need more assistance. We continue to talk about hydration, nutrition, and sleep. We continue to use our disease-modifying therapies, and we continue our conversations and engage our partners and our community resources whenever possible. Stage 6 is the most severe type of Alzheimer's disease. Our patients are really less able to care for themselves and need more supervision and assistance with their activities of daily living. Patients are a lot of times referred and returned to primary care if they've been under the care of neurology at this stage, because there are limits to what the specialists can do when it comes to the late stage of Alzheimer's disease. So we again want to focus on the basic needs of our patients, managing other neuropsychiatric symptoms, agitation, and other issues that may arise with supplemental treatments and therapies. We want to provide a lot of support to our care partners in all of the stages, but especially stages 5 and 6, because this is where they need the most support as they're dealing with this difficult diagnosis. It's important to remember that Alzheimer's disease can progress anywhere from 3 to 11 years on average. So some patients may move more quickly through the stages than others, but there's opportunities to intervene at many points along the way. So staging and identifying treatments, resources, and referrals is a great thing you can do for your patients. Stay tuned for our next video when we identify more of the tools for PAs, care partners, and patients.